Thank you very much. Good afternoon. Saskatchewan continues to stick it to COVID faster than any other province in Canada. We have now delivered almost 300,000 vaccinations, and over 70,000 shots were done in the last week. Again, I want to thank the thousands of dedicated Saskatchewan healthcare workers who are working long hours, 7 days a week, to deliver the largest vaccination program ever in Saskatchewan. And I want to thank the tens of thousands of Saskatchewan residents who are doing your part, making appointments, lining up in the drive-thrus to get your shot. We have now vaccinated more than 80% of everyone 70 and older, more than 2/3 of everyone 60 and older, and more than half of everyone in Saskatchewan age 50 and older. Our age-based sequencing is working well. We are getting as many people as possible vaccinated quickly as possible. And we are protecting those most at risk for serious outcomes. I am so pleased that we have been able to complement our age-based system with a number of priority groups. And yesterday, we were able to include frontline workers to those priority groups without compromising the speed and success of our vaccination program. That said, COVID can still be dangerous for people of all ages. So we are moving down through the age groups as quickly as we can based on supply that we are receiving from the federal government. Today, the Regina drive-thru is lowered to the age of 49. Tomorrow, the eligibility age will be lowered to 40 in the far north and 52 in the rest of the province. I know there is tremendous interest in getting vaccinated, and that's very great. Everyone has been watching very closely, waiting for their age to be called. In fact, I've learned that the exact age of some of my friends and colleagues based on which day they were able to go through the drive-thru. And they're all going to learn my age very quickly. We are going to keep moving down through the age groups as quickly as we can. We are also expanding the list of clinically extremely vulnerable individuals who can be vaccinated right away to include pregnant women and also 16 and 17-year-olds who meet the clinically extremely vulnerable criteria. While our vaccine program is going extremely well, the level of transmission remains too high in some parts of our province. That is why today, on Dr. Shahab's recommendation, we are collapsing household bubbles and reducing attendance limits at places of worship throughout Saskatchewan. We had hoped to avoid reinstating these restrictions, but it's something we need to do for just a few more weeks until we can get some more people vaccinated. Effective immediately, all private indoor gatherings are restricted to immediate household members only, with limited exceptions for co-parenting arrangements, caregivers, and service people. Maximum capacity at places of worship will be reduced to 30 people effective this Friday. Again, these new measures will apply to the entire province. These new public health orders, along with all the previous existing public health orders, are in place till April 26th, at which time they will be reviewed. I know some people may be wondering why these measures are province-wide. While cases may be low in their part of the province, transmission has been increasing in many areas of Saskatchewan, and until more of us get vaccinated, there is still a chance of catching COVID-19. I strongly believe we are getting close to having enough public vaccinations that we can begin to relax public health orders and restrictions, but we're not there yet. So thank you to everyone in Saskatchewan for all you're doing, for all the sacrifices you have made and continue to make. Thank you to everyone who has taken the time to get their shot. And thank you to everyone who is still patiently waiting. We will get to you as soon as we can. So when it's your turn, roll up your sleeve and stick it to COVID. Dr. Shahab?
Thank you, Minister. So I'll begin by, first of all, offering my condolences to the families and friends of 12 additional Saskatchewan residents of all ages who have passed away due to COVID-19 since Wednesday. And again, hospitalization and deaths are a reminder of why, even though our vaccination program is working successfully, we still need to pay attention to COVID and our rising case numbers. And while we have been focusing on Regina and the south of the province, we must now take further action to prevent transmission throughout the province. So with that, I'd just like to show a few slides initially. So as we can see, our case numbers in Saskatchewan have been were stable for a while after our fall wave, but then are trending up, and not just in Regina now, but in many parts of the south of the province. And we are not alone in this. Unfortunately, many provinces in Canada are seeing a high sustained wave, primarily driven by variants of concern. And if you look at Saskatchewan, our rates are not uniform. Initially, they were high in Regina, and then parts of the south were impacted. Parts of central and northern Saskatchewan are not impacted to the same extent, but we must now do everything possible to keep our numbers low throughout the province so that we can give vaccines a chance to prevent further illness and death. If you look at this graph, we can see that our overall case numbers per 100,000 are trending up, especially high in not just Regina now, but many locations in the south with high test positivity rate. Thankfully, the testing rates are also high, which is critical for contact tracing and isolating both cases and contacts. And majority of the cases now in Regina and central and southern parts of Saskatchewan now variants of concern. And of course, we are very concerned that Saskatoon also case numbers are trending up. Um, the test positivity is going up, good testing rates, and the proportion that are variants of concern are going up as well. So that's why Saskatoon really has to work hard to avoid following Regina's trajectory, and that would be, the two main sites of transmission are within the household. Obviously, we've seen how if a household member gets COVID, there's quick transmission to other members in the household, unless people are able to isolate successfully within the house. And then when people have a household bubble, we are seeing transmission happening quickly in household bubbles as well in all parts of the province. And from today onwards, we are recommending that we do have to stick to our own household indoors, and that's what worked well for us in December. And we really have to go back to that, as well as worship places capped to 30 starting on Friday. So really back to our measures that we had in December. And then in the north as well, while case numbers remain not as high as in the south, we really have to be very careful because in some cases we are seeing more proportion rates of concern. And we also have to make sure that testing rates remain high. And they are lower in some areas, and it's important that we seek testing. When we are symptomatic, we stay home and follow all public health guidance. The second area of transmission continues to be workplaces, and that's why it remains critical that all of us talk to our employers and our co-workers and see what work can be done safely from home. For what work do you have to go to a site or either an office or other site, and what are the protocols that we are all using in our workplaces, and how we can further enhance them, which can include using our best mask. If you're working within 2 meters, using a medical mask and a face shield, in personal care services, for example. Making sure that we work in cohorts if you have to work closer than 2 meters, being especially careful around break times, and of course, quickly isolating if you're symptomatic and seeking testing and not going to work. So this will be critical, both in reducing household transmission and transmission in workplaces, the two places where transmission is continuing. And of course, if we're out and about shopping, maintaining a safe distance, and as always, outdoors is better than indoors. Our reproductive rate, it was high over the fall, over 1, which means that there's exponential growth. There's a bit of a dip over December, and then it came down over February, and that was the end of our second wave. But unfortunately, it has come up again above 1. primarily driven initially by Regina alone, but now increasingly by the south and the rest of the province as well. So again, we need to keep this not just at 1, but well below 1, because we all know rates of concern are 60% more transmissible. So 1 is not enough. It has to go really at that 0.6 number again, and we really have to work hard to get there. Most of our cases, as we know, have always been, this is our cumulative numbers, have always been in people 15 to 49. These are the people who are out and about at work. We have had hospitalizations in every age group, and very low in school-age children, but otherwise in every age group, obviously hospitalizations increase with every age group, and so do unfortunately deaths, that they start really trending up after the higher than the age of 50. And if you look at these numbers over the fall and spring, we see that our cases have always been high in, under 59 with our, fall waves and now our third wave, and lower in people 60 and older. Hospitalizations were higher in people 60 and older. Thankfully, they are much lower now, and this is primarily due to the impact of vaccination. And hospitalizations concerningly have gone up a bit in the under 59, and that was certainly seen very clearly in Regina. And we have to do everything in our that we can individually, as families, as communities, as people, as employers and employees, to keep these numbers low in the under 59 till such time that all of us are vaccinated. And of course, deaths unfortunately were high in the over 60 in the fall, and then they have come down due to vaccination. But we have to make sure that while the risk of dying is lower in under 69, it's still there, and variants of concern are more transmissible in some ways, could be more virulent. So we have to be especially cautious around that. And again, our colleagues in ICU, acute care, have been working extremely hard to provide the best care possible, but we have to make sure that we do everything we can to keep ourselves, our family, our co-workers, and our friends out of the hospital and not getting COVID in the first place. And again, this just shows that our cases, have always been higher in that, 19 to 39, 40 to 59 group, lower in people who are under 18 and over 60. Hospitalizations have been higher in that over 60 age group, but coming down, and then have been trending up in that 40 to 59 age group, especially marked in Regina right now. And deaths, fortunately, have come down dramatically in the over 60 age group, primarily due to vaccination. People who are still not vaccinated, 60 and older, please, once you're eligible, you're always eligible. Please do get vaccinated with any vaccine that's available for you in where you are in Saskatchewan. And of course, that also then applies to every age group who becomes eligible. As the minister said, as you become eligible by age or by virtue of belonging to a specific essential worker category, please get vaccinated at your first opportunity. Our uptake has been great for first doses, 80 plus, 70 to 79. It's coming up 60 to 69. Obviously, we expect to see a quick increase as vaccination clinics open to 50 to 59 over the next few days, and then over the next few weeks, younger age groups. And we have to remember, we want a high vaccine uptake by end of May in all persons 18 and over, and then quickly, that our work is not done. 1 dose is good, 2 doses are better to complete the vaccine series. We quickly, as soon as we have high uptake in all age groups, and as supply allows, we need to start our second doses for 18 over, hopefully by end of May, early June, as supply allows. So with that, I just want to close by saying that, we know the fundamentals, we know the basic principles. With the slight tightening of orders throughout Saskatchewan, no indoor household bubbles. We really need to focus on wearing a mask whenever we are outside, especially in indoor places, physically distancing, minimizing our close contacts at work or socially. Outdoors is better than indoors. We've had some, snow and some, icy roads over the south of the province, but certainly the weather has been great. It promises to be better. And, outdoors is always better than indoors, but even outdoors, not getting together over food, not sharing things back and forth, but spending time outdoors with friends and family while maintaining a physical distance is going to be critical. And of course, staying home, even if you have the mildest symptoms, and getting tested and following public health guidelines. And finally, I will just close by just speaking to that we have received information from Health Canada that we have had one a report of a vaccine-induced thrombotic event in Canada, not in Saskatchewan. I understand it was in Quebec, reported by Quebec. So all the protocols that we have to monitor vaccine safety worked in this case, and all the appropriate testing and treatments were done. I understand the person is recovering well. So, while we understand that adults who went from vaccine are extremely rare, there's a well-developed system to investigate and report and manage. And for those rare thrombotic events that have been reported due to vector-based vaccines, AstraZeneca, and now this morning we heard from the US as well, these are always fully investigated and managed, but the risk at less than 1 in 100,000 is much lower than the risk of COVID for people 55 and older. So again, we have to, I would highly recommend we receive whichever vaccine is offered to us when our time comes based on age or other criteria. For 55, all 3 vaccines you're eligible for all the 3 vaccines, but at any clinic on any given day, you may have either of the 3 vaccines. When my turn came and I went, the vaccine that was available was the AstraZeneca that I gladly took. And many of my colleagues have taken AstraZeneca in that age category. If you're 54 and under, right now you are eligible to receive either Pfizer or Moderna. But again, when you go to clinic, there may just be the one vaccine available for your age category. And it is critical that we continue to receive vaccine as our age, as we become eligible based on age or other parameters, clinically vulnerable or other, specific groups, because that is really our way out of the pandemic. Thank you.
Thank you, Dr. Shahab. Thank you, Dr. Shahab. Thank you, Minister Merriman. We'll now move to questions. We'll start in the room. Mary Mandrick with the Leader Post.
Thanks. I guess I don't understand, or perhaps you could explain why the emphasis with the new rules are on households when we know that in Saskatoon, I believe it was 77% of the transmissions between March 25th and April 8th were workplace. I think in Regina it was 55. It doesn't seem that you're addressing where the problem is, but the emphasis was still on households, and I really don't understand why. Why not at least at bars and restaurants in Saskatoon and elsewhere where there seems to be rising cases?
Sure, I'll start and then maybe I'll get Dr. Shahab to finish. We've had for a long time in Saskatchewan a work from home, if you can possibly do that work from home. So that's one thing that we've had consistent to be able to make sure that the transmission in the workplace is minimized. The other side of it is we also have seen household transmission across the province where people are getting together, especially potentially over the Easter break, that they were getting together and using those common touch points, whether it be at the dinner table or in the kitchen or in the bathroom, that we have seen that. Maybe Dr. Shahab could give some more detail.
Yeah, thanks, Murray. So, household transmission, I think within our homes, obviously when we have a household member with COVID, usually exposure has happened to other household members. And with variants, also the attack rate within a household is high. And because up to 40% of infections can be asymptomatic, whichever strain it is, original strain or variant strain, we've seen that whenever people have expanded their bubbles, with the increase in transmission in Saskatoon and other places, we really want to reduce the risk of transmission within the household. So the household transmission, isn't always reported as a separate category, for example, as an outbreak necessarily. But this caution around household bubbles is again critical, like it was in December. And of course, all workplaces, like whether it's the kitchen in a restaurant, whether it's any other workplace, if you can work from home and can work remotely is critical. Otherwise, we have to review all our COVID protocols. Like I said before, for many workplaces who had excellent COVID protocols that worked well all the way till February, are now not working that well. So again, reviewing all COVID protocols, including staying home when you're sick, physically distancing, using a mask and face shield when you can't work when you have to be closer than 2 meters, for example, in personal care services. At all other times, using a mask when in an indoor public space with other people is going to be critical. And I have to say that if Saskatoon is at the cusp, and if unfortunately case numbers continue to rise in Saskatoon, other measures will have to be considered. But right now we have to give everything we can throughout the province. Saskatoon, other communities in the north, as well as, of course, many communities in the south have seen higher case numbers, don't have the same restrictions in Regina, but we saw in Moose Jaw, for example, voluntarily people were, many restaurant owners were promoting takeout rather than in-person dining. And actually, lots of stories of customers supporting their restaurants and businesses through, takeout, other businesses, retail through curbside pickup. So even though a retail location or restaurant is open, we all must use the lowest risk way to either get something to eat or buy something we want locally, which includes curbside pickup and takeout. Thank you.
Follow up, Mary?
Okay, I guess starting with Dr. Shahab, I guess I'd like the minister to respond as well. If that was the case, why did we not have travel restrictions beyond Regina at Easter time? Why did we not have them province-wide at that point? And I guess more specifically, why are we not having them now, given that that seems to address all of the concerns that you're talking about in terms of how to stop spread most efficiently?
Yeah, so I have always said throughout this pandemic, stay close to home. Even during the summer when our case numbers were low, I did say that enjoy the amenities closer to home, parks and playgrounds closer to home, closer to your neighborhood. And that's especially true now. Stay closer to home. Over Easter, my understanding is most people actually did stay closer to home. But unfortunately, there is a risk now that in case people did visit with families and they, or went to other provinces, there is a risk that we may see a bit of an uptick post-Easter. And we're very concerned about importation of other variants of concern. Right now, the vast majority of our variants are the UK 1.17, first identified in UK, but obviously we're worried about 1.351. We only have had 9 detections and no further detections, and we're extremely concerned about P1, first described in Brazil. We have had no detections in Saskatchewan, but detections in many other provinces. So, it's absolutely critical we stay close to home, we minimize our contacts outside our household, be very cautious if we work outside the home. And the most important thing is we continue to get the vaccine when we become eligible. Make sure that the SHA runs out of vaccine well before the next batch comes.
You just heard from Doctor, why is the government not imposing province-wide travel restrictions? Is it just too impossible in a province like Saskatchewan in the mind of the government, or is there other reasons why we shouldn't be doing that right now?
Well, I think it's a continuously that balance between the compliance of the restrictions that are out there that are in Regina, and we've seen since we've implemented those restrictions in Regina, we've seen the numbers stabilize. They're stabilized at a very high number, which is a concern, but we've also seen that stabilize in Moose Jaw and some of the other perimeter areas in and around the southeast part of the province. So we're confident that this will stabilize in Saskatoon as well, but we have to make the decision on what we have at that moment in time, and it's sometimes easier to look backwards and say, well, we could have done this or could have done that, but we have to make the very calculated decision at that moment in time on what we're doing, and at that moment in time we wanted to ring fence Regina, and I think we've done a very good job, and the Regina residents have done an extremely good job of adhering to that, because the numbers haven't gone anywhere near where they were projected to go to.
We'll take a question on the phone lines.
We have Kelly Malone with the Canadian Press.
Hi, Kelly Malone with the Canadian Press. Obviously, with this surge in cases, especially with the variants of concern, you're seeing higher rates of hospitalization and more people and younger people in ICU. Can you give us a breakdown of the actual pressures on the healthcare system right now? How many ICU beds you have, how many have been opened, and the capacity?
I'll get Scott Livingstone to touch on that, but that was one of the areas that we were trying to protect with the restrictions in Regina to make sure that we didn't get into a provincial healthcare capacity, because we still have lots of capacity in Saskatoon. Regina is feeling some pressure right now from the hospitalizations and the ICU, but Scott, I'll get you to touch on the capacity, where we're at, and what we have.
Thanks. So Kelly, as you pointed out, hospitalizations have increased, particularly Regina in the south. So we're currently sitting at 203 patients inside hospitals and 41 in ICUs. As you've already heard, both in Saskatchewan and across the country, the demographics of patients that are showing up at hospital and infected are younger. So we're seeing lots of younger folks coming in to the facilities that are quite sick. So with respect to capacity, Saskatchewan has on a regular day-to-day basis around 75 ICU beds. We have the ability to double that surge capacity for full to go to approximately 150 beds. We're not there yet. We continue to have capacity outside of Regina. Regina has been quite full and has been on bypass, but we still have not used all of our capacity and are working as a provincial organization to balance care for patients, both as inpatients, but also as ICU patients in the province.
Kelly, do you have a follow-up question?
I do. So if this stabilization of numbers doesn't come fast enough for new infections, what other restrictions will you be looking at, and when would you consider implementing them?
Well, our current restrictions are in place till April 26 in Regina and in the province, the ones that we just announced today. We're evaluating this on a daily basis, but again, we're making sure that we're keeping our restrictions in place and asking people to comply with those restrictions, but balancing that out with a very, very aggressive vaccine program that we are rolling out in and around 10,000 vaccines every day in the province. That's about 1% of the province that gets vaccinated every day. We're continuing to focus on both sides of this. As Scott has alluded, there's an offensive and defensive side of things. The defensive side of things is the restrictions that we have in place. The offensive that we have are the vaccination clinics that we've got running in 125 plus communities across the province.
Take a question from Mark Smith, CTV.
Yes, since the public health measures were loosened on March 9th, the province's 7-day case average has almost doubled, and active cases have increased by over 1,100. Was it a mistake to loosen those restrictions at that time with variants spreading?
No, again, we made the decision at that point in time on what we had in front of us. We've seen other jurisdictions that were locked down during that entire time that are still seeing surges in cases in specific areas. So again, we made that decision with what we had at that moment, and we were confident with the compliance in that. The variant throws everybody in the country and around the world a bit of a curveball. It does change things up, and we had a minimal amount of cases of the variant in the province at that point in time, and we made the decision to loosen up restrictions for a temporary period of time, with at the time saying that these can be tightened up very quickly, and we did respond very quickly when the variant started taking hold in Regina.
Follow up, Mark?
Yes, on a different topic, we've heard from some immunocompromised individuals who had a vaccine appointment scheduled in Watrous, which was using the AstraZeneca vaccine at that clinic. They were turned away because they didn't meet the age requirement for AstraZeneca. What is the SHA doing to avoid situations like this and ensure people who have appointments for vaccines are able to get their shot?
Yeah, if we had everybody that was sent out, I believe there's about 25,000 letters that were sent out to individuals that were immune compromised across the province that made the list of getting their vaccine. If the vaccine is not specifically available that they have to get in their community, then we can certainly try to accommodate that. I would encourage them to call into the SaskVax number, talk to an individual, and we'll see if we can accommodate that. I don't know, Scott, did you have anything to add?
Just to add to that, Mark, the vaccine clinics have clinical staff there and do an assessment of individuals as they do come in. So when people book appointments, we don't always have information with respect to what their medical history might look like. So that's why those assessments, both with medical professions like physicians and nurses, are there to make that assessment. I'm not aware of this specific case that you speak to, but in circumstances similar to that, what we would do is have a conversation of the risks and benefits based on that particular individual. And then if that vaccine wasn't suited for them, that was available at the clinic, work with them to book a different appointment.
We'll take a next question on the phone line.
We have Laura Sharpaletti with CBC.
Hi there. Thanks for your time. We've heard from long-term care residents who are fully vaccinated yet still subject to strict restrictions, even lockdowns due to positive cases among employees. In some cases, employees rejected the vaccine. What do you make of the staff refusal, and what consideration have you given to mandating vaccines for long-term care workers?
I'm not going to comment on anybody. It's their right to refuse a vaccine. If they do not want to choose to get a vaccine, that is up to them. But we would encourage everybody to get a vaccine. The only way that we're going to get through this is by having more people vaccinated. That doesn't matter what industry that they work in specifically, whether that is in healthcare, whether it is in a retail setting, whether it's a restaurant setting, whether it's manufacturing, agriculture. We want everybody to get a vaccine as soon as possible. And we are encouraging, I have met with all of the union leaders within the health area to be able to talk to them specifically. They are encouraging their membership to get vaccinated. So it's coming from the government and the management side, but as well as the union. So I'm very glad that they're able to help us encourage their membership to get vaccinated as soon as possible. And again, if somebody is eligible in that first priority sequence, and you can check this on our website, that means you're still eligible. Nothing has passed you by. You can still go and get vaccinated right away. You can book your appointment, or you can come through the drive-thru clinic if you're still eligible and you didn't have time in the last few weeks. I'd encourage you to try to find some time and get vaccinated.
Follow-up question, Laura?
I do. It's again about the AstraZeneca vaccine that we were just speaking about. So we've been told anecdotally that there were a lot of open appointments yesterday for vaccination, and that there have been people who have been refusing to take the AstraZeneca vaccine. We're just wondering how many people are walking away from appointments because of refusing the AstraZeneca.
There are some people that are choosing not to get vaccinated at a specific time for whatever reason. But I'm very encouraged by the almost 10,000 people that are getting vaccinated on a daily basis in our province. And we are trying to accommodate if people have some medical conditions that they cannot get vaccinated with a specific vaccine, or if they have an age requirement. We certainly try to accommodate that as much as we can. But again, the vaccine numbers overall at 10,000 a day. We're leading the country, and then some areas of our vaccine rollout, we're in the top 10 in the world.
Take our next question on the phone line.
We have Laura Fominoff with CKOM.
Hi there. Thank you so much for taking my question. According to the Health Canada vaccine delivery guideline, Saskatchewan is expected, I suppose at this point, to get around 256,000 vaccine doses, the Moderna and the Pfizer, until the end of May. Last week, Premier Moe gave a very ambitious timeline for everyone over the age of 18 able to get their first vaccine dose by May 17th. With 300,000 people, about that amount, vaccinated now, and you add those vaccines that are expected until the end of May, that's only about 550 or so thousand people. That's about half the population. So are you sticking to that vaccine timeline?
Absolutely, we are. We're very encouraged by that. What isn't taken into account within that is we have had 2 delayed shipments of Moderna. We had a shipment that was going to arrive on April 5th that didn't arrive until this week. The shipment that was supposed to arrive next week for Moderna is now, or on the 19th, I believe, is now arriving on the 26th. So we've had a huge delay in our Moderna. And we don't have any Moderna scheduled from the federal government. Usually they come in every 3 weeks, 2 to 3 weeks, a Moderna shipment. We haven't seen anything past April 19th. We're expecting that we're going to get in and around 30 to 40,000 every 2 to 3 weeks. which would make a huge difference. So the delay of the Moderna coming in, we did have some delay of Pfizer. We've had to reschedule in the last 3 weeks because of these delays, about 30,000 appointments. So that does change things very quickly. And it's very important for everybody to understand that, you know, we had about a 2 to 3 day supply of vaccines on hand. That's how quick we're booking these out. We're booking appointments out for, you know, anywhere from 14 days out in some areas, but yet we only have about 2 to 3 days supply of vaccines. So we're moving those vaccines as quick as possible. If there's delays, that causes some problems, but we're very much hoping that we're going to get some more Moderna vaccines, anywhere from 60 to 80,000 before that timeline that the Premier laid out. So that would be the difference there.
Follow-up question, Laura?
Yes, please. Saskatoon has been now listed as an area for variants of concern. Will Saskatoon get a drive-through similar to the one in Regina, where age groups, like you're taking 49 to 54 now, will Saskatoon get a similar drive-through, and if so, when?
We're looking at some options right now to be able to move. Right now, we're restricted by the drive-through of the age limit of AstraZeneca, but we are actively considering doing something very similar to Saskatoon, where we did with Regina, where we're moving some of those AstraZeneca into booked appointments for anybody over the age of 55, and moving Pfizer into the drive-through so we can do that. We're actively looking at that. We're just looking at working out the logistics, but we are very much boxed in by the age limit of the AstraZeneca, which has been our main vaccine for the drive-throughs.
We'll take another question on the phone line.
We have Zach Becerra with the Star Phoenix.
Good afternoon. Minister Merriman, I'll admit I'm a little confused. Yesterday, when you spoke to reporters, you indicated that the trends in COVID-19 numbers were stable, and then you said something to that effect earlier in this press conference. Dr. Shahab has presented that we're in exponential growth across the province and we're heading in a worrying direction. He even said Saskatoon is at the cusp. So I guess my question for Dr. Shahab is, what are we at the cusp of? And my question for Minister Merriman is, why are you confident in our current trajectory with these new restrictions, given the worrying numbers that we're seeing right now?
Maybe I'll ask, I'll touch on the first part of that. I mentioned that the numbers have stabilized in the Regina area in and around that 100 to or 90 to 110 range. So I did say, and I also said that they had stabilized at a higher number that I would certainly like to see. But I'm also confident in our vaccine program that we're rolling out in complement. The vaccine is the end. That is the goal that we need to get to. The restrictions and the public health guidelines are what we are using to be able to minimize the impact within our healthcare system and our communities until we get to that goal line. So maybe I'll get Dr. Shahab to touch on that as well.
Maybe I'll quickly also comment on the earlier question, Minister, because when we calculate population numbers, and we can certainly make sure the numbers are more. So one number is when you can book for an appointment, and when you actually get it maybe a week or two later, plus the allocations are estimated for population 18 and over, because currently the vaccines are primarily being allocated for 18 and over population, not the entire population. And once you're eligible, you're always eligible. But you know, the SH is doing a tremendous job of keeping a tight supply line so that you don't wait for one age group to finish before you open it up to a younger age group or other priority populations, clinically vulnerable or other populations. So it's a very dynamic, tight supply line. And of course, as we move down to younger populations and as supply allows, we'll at the same time be starting second doses. So the numbers are quite complex, and the distribution logistics. And I just want to recognize all the people, not just the people in the vaccination clinics who are doing the clinical counseling, answering questions and giving the right vaccine at the right time, but also the tremendous people, supply and logistic issues that people are working tirelessly behind the scenes, 7 days a week to get this, biggest vaccination program in our history working seamlessly. So I just want to recognize that. And then regarding case numbers, we have seen what has happened in Europe. Even though, many countries have strong vaccination programs, the UK and the US, they still have to watch out for the surge and due to variants of concern, they still have to be cautious. And while our vaccination program is picking up and is moving along at a quick pace as much as supplies allow, we still have to remain cautious because we can't still let, because the majority of population under 50 is still unvaccinated. So we have to be extremely cautious not to let COVID and especially variants of concern overtake us if we let our guards down. And it is a balance. It is a balance that we had quite a comfortable summer last year. Early fall was quite comfortable. We had our challenges with the fall wave. Thankfully now we are not seeing the same challenges in long-term care, but we still have to be cautious in each age group as we are getting vaccinated. And we have to remember that 1 dose is good, 2 doses are better. And so we have to, be aware of all these things. And certainly the hope is, like the minister said, once we have 1 dose in arms, 18 and over, then there may possibly be many things we will be able to do as our case numbers become low. And then, of course, with 2 doses in our arms, in June, July, and for some it may be as late as August, that will open many other opportunities. And of course, in the fall, we will hopefully have a program for school-age children as well.
Follow-up questions, Zach?
I hate to do this, but my question wasn't about vaccines. You said Saskatoon is at the cusp. That's what I heard anyway. I'm wondering what it's at the cusp of. What would be taken into consideration if tighter restrictions were to come into effect in Saskatoon? What would you need to see from your perspective to make that call? What's going on in Saskatoon?
First of all, we saw that when the variants of concern came in Regina, they came very quickly. They became the predominant strain. And then that caused an escalation in case numbers very quickly. So Saskatoon is at the cusp because of 2 things. One, while their overall numbers remained low throughout March, while numbers in Regina were high, the numbers are now trending up. And while their variants of concern were as low as 16% last week, they're now in that 30 to 40%. So again, the proportion of their new cases that are variants of concern are trending up. Overall case numbers, variants of concern are low, but on a week-by-week basis, and they are finding an increasing proportion of variants of concern, and that is very concerning. So, Saskatoon needs to do everything it can right now to prevent following the trajectory in Regina. So at present, it means additional measures, but then at the end of the day, it is up to everyone in any community, including Saskatoon, to really comply fully with those measures. And if required, further measures may be required. But again, I don't think we need to wait for case numbers to rise even further. So all the things that we discussed earlier that other southern communities have done, minimizing contacts outside the house. If you have to shop, look at curbside options. If you want to get some food, takeout is better than in-person dining. Minimizing social contacts outside your household, spending time outdoors more than indoors, all of those are going to be critical because Saskatoon is at the cusp in terms of it is trending up slowly, but in a concerning direction, both in terms of total case numbers. So cases per 100,000 are trending up, they're around 15, and test positivity is trending up, and proportion that are variants of concern are trending up, as in the table that I showed. Thank you.
Take our next question on the line.
We have Caitlin Wilson with Global.
Hi there. It seems that some are confused on what vaccine they are getting when they book appointments, and those with underlying conditions are hesitant about getting the AstraZeneca vaccine. And in one case, we heard in one instance, somebody with an underlying medical condition was told when they went to their appointments they weren't giving people with underlying medical conditions the AstraZeneca vaccine, but she was told by her doctor it was safe. So there seems to be some confusion there. What is your message to people in terms of who should and shouldn't get the AstraZeneca vaccine and the safety for those with underlying medical conditions?
my message to them would be any vaccine that is out there is a good vaccine in your arm. If you do have some underlying, as Scott Livingstone identified earlier, when somebody books an appointment, we don't know their medical history. They're booking an appointment either online or through the phone. We don't know what the depth of their medical history is. If they have some concerns about a vaccine, I would encourage them to go touch base with their doctor or their specialist to be able to provide that information. We'll try to accommodate as best we can. But if someone is booking a vaccine or booking an appointment to be able to get into a clinic, we will give them the vaccine that is available on hand at that specific location.
Do you have another question, Caitlin?
Yes, my next question is for Dr. Shahab and people who are vaccinated. For them, what is your message for them in terms of how are they supposed to act right now? I think as more people get vaccinated, people are wondering if I'm vaccinated, is it safe for me now to visit my in-laws, or can they still pass COVID around to us? Can they socialize with others? How should people be acting going forward as vaccinations ramp up?
Yeah, thanks. So I think that this is a really important point, because there has to be some benefit to us individually as a society after getting vaccinated. But we have to remember that some countries who are ahead of us, like the US, who've completed for a vast majority of their population not just one dose but 2 doses. Their guidelines now allow for more visitation among vaccinated households, fully vaccinated with 2 doses. In Canada, our supply is such that we are currently completing the first dose. But as we start the second dose, I think our options will improve. Certainly what we want right now is with 1 dose in 2 arms. Right now in a household, not everyone can get vaccinated at the same time. You have to go as you become eligible by age. So certainly all the cautions, unfortunately, will have to remain at least till the majority of us have 1 dose. And we are watching closely data from the UK, who also has a delayed second dose program, who are actually, again, ahead of us by about a couple of months, but again, allowing restrictions to open up very cautiously based on case numbers, proportion, variants of concern. In the UK, the predominant strain is B117, just like in southern Saskatchewan now and many parts of Canada. But we unfortunately do have to remain cautious at least till June, till the majority of our adult population has had 1 dose, and then we will have to assess uptake, impact on transmission, our overall case numbers, before recommending any significant relaxation of some of the broader measures like mask use in indoor places and significant increases to gathering size limits. But certainly before that, I don't think we can relax measures significantly. In fact, unfortunately, not just in Saskatchewan and Canada, but in many places like the US, even with their high vaccination uptake, when you still see a surge in younger people, that still has impacts in terms of higher hospitalizations, and sometimes the measures have to be tightened up for a bit. But hopefully, by June, with 1 dose in arms, we are in a better place. It's summer, and then as we look at what further measures can be relaxed, we absolutely have to make sure that anyone who got first dose, we have to absolutely remember to get our second dose, because first dose is good, second dose is better. That provides you that long-term protection that will protect us into the summer and fall. Thank you.
And we'll take another question on the phone line.
We have Thea James with the Star Phoenix.
Thank you for taking my question. I wanted to put this question to Minister Merriman. Given the rising cases of COVID-19 at the Regina Correctional Center, will you be revisiting the issue of vaccine priority for correctional staff?
Thanks. It's a very good question. Right now, we've only seen outbreaks declared in 2 correctional facilities across the province that I've been made aware of. So we're monitoring this very close, but we are making sure that they are adhering to all of the protocols, such as the masking, the cohorting, which will help make sure that the spread doesn't go through that correctional facilities to any other offenders. So right now, we're focusing any additional vaccines we have on first responders to any scenes, as well as healthcare workers and people that are inside the grocery stores that we've identified that have pharmacies when we get the rollout to the pharmacies later on in April.
You have a follow-up question, Thea?
I do have one. I just wanted to know if there is a break in terms of at what level or what point do we have to hit for there to be a change in whether there's priority vaccinations given to correctional staff.
Yeah, right now we, as I've identified, we have a very robust booking system that we continue to utilize, and we're taking as many vaccines out of that to our mobile clinics to be able to target the specific areas that we announced yesterday. We'd have to do some consultation with Dr. Shahab to see if there's anything specific that we would look at within the correctional facilities. But again, that is obviously a very contained environment where they have opportunities to be able to put people into different areas to make sure that they are kept safe. And I'm sure that the correction workers, and again, it's not that correction workers aren't eligible. It's right now, if there's a correction worker out there in the city of Regina that's 49, I would encourage them to go to the drive-thru and get vaccinated immediately. If somebody's over the age of 52 and wants to book into one of the clinics, I would encourage them to do that as well. So it's not that they've been excluded. We're just trying to get through as many as we possibly can.
Come back to the room for any additional questions. Murray?
Yes, thanks, Matt. At the crosshairs of workplace and household transmission, if that's a combination problem, would seem to be schools. So I guess the question becomes, why have we not seen greater emphasis given these numbers on on teachers' vaccinations? And I guess secondly, given the new restrictions today, why is the government not being a little bit more adamant about schools extending their online learning under the circumstances of what we're in? And I guess if I may also ask, it's a three-part question with one part totally unrelated. Correction centers, with the numbers are going up there, and is there also thought that maybe that needs to be a prioritization for vaccinations?
Well, again, I'll touch on the teachers and the correction. They're both eligible, as I just identified, if they're in that age category. And as far as online, we've opened it up that any school jurisdiction in the province has the ability to do that. I know Regina has extended out their online, and there was options to extend out the Easter break as well, which some did take advantage of. So we feel that that's better, because there were some school divisions in the province, and talking to the Minister of Education, that did not want to do that, and they did not want to be pushed to do that. They want to have the kids in front of them as long as possible and as often as possible. If they have that option to be able to do that, I think that's best made at the local level. And again, teachers are included in our age sequencing. If there's some teachers out there, I think this is towards the end of the break. If there's an opportunity on the weekend to go through the drive-thru, and I would encourage any of them to do that.
Mark?
Craven Country Thunder was just canceled. Looking to the summer, has there been any talk with the Saskatchewan Roughriders about approval to play with fans at Mosaic Stadium? Has there been any discussions around that?
I'll start with that. I haven't been involved in any conversations with the riders specifically on that. We're hoping that, as Dr. Shahab identified, that we can get 1 or 2 shots into everybody by midsummer. That obviously has an impact on many festivals and many cultural events that are out there. Craven is one of them. And I understand that they had to make a difficult decision. Maybe Dr. Shahab, if I can get you to touch on any conversations with the Saskatchewan Roughriders.
Thanks. So regarding the Saskatchewan Roughriders, obviously they have developed very good protocols for return to play, so that it relates to players and teams. But regarding outdoor crowd limits, both in the Mosaic Stadium, I think again we will, and that same would apply to other events. We again have to look at population uptake, 1 dose and then 2nd dose, and then very cautiously allow outdoor gathering limits to increase over the summer. We're obviously monitoring both vaccine uptake, local transmission rates, and how those gatherings are structured, physical distancing among individuals and households and cohorting within groups so that, you don't have random mingling of large number of people with a bit, some cohorting. And we've done that, if you remember, last summer as well with graduation ceremonies and other ceremonies. So we certainly are looking actively at what can safely be allowed over the summer. And again, that is really the goal, that we want to start going back to life as normal as quickly but as safely as we can.
And I just maybe have one additional comment on that. As I'm looking forward to it, and everybody's looking forward to having a better summer than last summer, the best way that we can get the riders back on the field, the best way we can go to our events, whether they be cultural art events, is getting your vaccination done as soon as you possibly can. That is how we are going to get back to that. We can open up these festivals and open up these things that we missed last year. So if you can get in and get your vaccine shot, that's the way that we can certainly move down the path a lot faster to getting these festivals and these sporting events back open.
Thanks, everyone. That concludes today's availability.